You're all welcome to the panel. And we've heard from the Honorable Minister of State for Health. We've also heard from the First Lady of Imo State. And we've also heard from Population and Policy Innovation Center about issues around gender norms for young girls, especially young, very young adolescents. And so my first question will go to Dr. Amina. And so we're talking about gender norms here. And in 2 minutes, maybe you tell us a bit about, from your experience at service delivery points, how do restrictive gender norms show up when adolescents, especially very young adolescents, try to access health services?
Thank you very much, and thank you for having me in this very important panel. So very briefly, from our own experience, because we are almost always on the field in the service delivery points, and service delivery points mean where people actually receive care. It could be pharmacies, it could be clinics or hospitals in the communities. And so what we see is that, the fabric of those service delivery centers are actually gender biased. Why do I say so? I'll start with our hospitals, and I'll start with the structure of the hospitals. You'll find out that most often there are wards that are designated for women, for children, for males, for females, female ward and all that. But that unique group of people between that 10 to 14 especially, they don't feel connected to the children, and they're not really adults. And we don't have a ward that is specifically designed for them to even be free and to have a safe space in our clinics. So that is one. The second thing is that even when you go to clinic, the clinic days, you have children's clinic, women's clinic, you don't have adolescents clinic. That is really a problem, because that group of people have unique needs. Most of their needs are psychological. They have needs, biological needs, physiological needs that are not really, designed to be taken care of in our service delivery points. Then I'll talk about our health workers. Most often our health workers do not have that special training to address the needs of young people within that age bracket that have those specific health and wellness needs. And if you don't have that skills, there's no way that you can be able to address them, because we have, services for women, antenatal care, deliveries, we have children's services, we have postnatal care, we have neonatal wards, but there's none designed for them. Interestingly, especially for our males, someone in the other panel talked about males. The men, or rather the young boys that are really about to be men, they have that unique needs, and when they go to the hospitals, most of the healthcare workers are females. They are mothers' age groups, and they are afraid, because when they reach those hospitals, they know that there's some biases, that's expected of them, especially when they're about to receive sexual and reproductive health services. Unfortunately for us, we all know that even though the general, belief or traditional expectation is that these people are not sexually active, but we know that it's not rocket science. A lot of them are sexually active. So I would just like to say that even the data, we don't really disaggregate data by adolescent, that age group. We have children or adults, male or female, but that age group too, if we want to really understand their needs and where the gender issues are, we have to disaggregate that data. Policies are there, but the implementation at that level is what we need to all look at. But again, I would come back to the healthcare workers. The biases that our health workers have, it's really, really huge. Most often you don't know, most of us have values, have beliefs, have perceptions that we grew up with. We don't know how it affects the next person. Some of our thoughts, especially when we are supposed to provide those services, we need to remove ourselves, remove our values, and provide service delivery, quality service delivery. And when we say quality service delivery, that has to be effective, efficient, equitable. It has to be timely, and it has to be patient-centered. That is a very critical one, patient-centered. It means every individual, no matter the age bracket, no matter the gender, no matter the needs, they need to have unique patient-centered care. Thank you very much.
Thank you very much, ma'am. I mean, maybe taking a segue from some of your discussions, that there's an issue around some sort of stigma, to be honest. And maybe if we look at now to the country director of Marie Stopes, do you see stigma and silence around issues around adolescent sexuality? Do you think they block people from accessing the services they need?
Thank you very much, Jennifer. So, lots of what happens with adolescents is what comes from the level of stigma that is happening in the communities. From our experience, I mean, sometimes the worries will actually be, do we have the right places where the adolescents will go? But the bigger picture or the bigger problem that we are facing is even when these places do exist, the adolescents still find it very difficult to go there because they are often stigmatized. In the communities where you and I exist or we have come from, it is believed that most of these adolescents, like Amina has mentioned, are not meant to be sexually active. And we do know that they are sexually active. And because they know that they will be stigmatized by just approaching a service provider in those locations, they decide most times to put themselves out. And pulling themselves out implies that regularly they will rather go to locations where they are not meant to go to, especially from untrained providers. And those are the locations where they often go and take up services. Thank you.
Thank you very much. At this juncture, I'd like to just invite Dr. John Ovuari, who heads the Gender, Adolescent, School Health, and the Elderly Program at the Federal Ministry of Health. Is representing Dr. Ukaire to please come to the front. My apologies, I did not see you in time. You're very welcome. Thank you very much. Welcome, sir. Welcome, sir. Okay, so maybe I'm going to leave you to settle down because I've asked my next question to Dr. Binyerem. But Dr. Habiba, we all say, and that's something that we often say in the sector, that if we educate all the women in Nigeria, that all our issues will be solved. You know, the issues around health, and the data seems to suggest so. And so my question would be, what type of practical education-based approaches have you seen that could shift norms? You know, the First Lady was talking about transformation. The time for transformation is now. So what are those education-based approaches that could actually transform the gender norms that we've seen from this survey that are quite bad and protect girls from child and forced marriage?
Thank you so much. For us at the Center for Girls Education, we support girls to enroll in school, stay in school, and complete schooling. And from what we do, our expertise is in safe spaces. And we provide life skills and intensive literacy and numeracy to girls in very rural communities and poor urban communities. Now, if every girl in every school, in every community, is able to have access to life skills and quality education, I believe we will not be here talking about early and forced or child marriage, because every girl will have what she wants to look forward to. They will have aspirations, they will have a future and a goal that is set for them that they want to see. So I believe that if the government of Nigeria and all other state governments are able to bring in these safe spaces, improving it with life skills, just like we have in the Agile project, every girl, wherever she is, will want to stay in school and complete schooling and be who she wants to be in life. Thank you.
Well, Ma, looking at it from your perspective, where do you think these girls could find the mentors that they need to provide them? For example, you're talking about safe spaces, and safe spaces are usually led by mentors. So from your own perspective, where could these girls, these very young adolescents, these girls in rural areas, where would they locate mentors that will be able to provide them with the support they need to address some of these norms?
For us, we train mentors, and the mentors we train are either teachers from primary or secondary schools or people from the community that these girls come from. We train them intensively and we retrain them, and we have review meetings every month so that we can be able to strengthen their capacity. And these mentors are people that these girls trust, because of the way they mentor them, the issue of beating. There is no beating in safe spaces, no use of vulgar language. We have safeguarding policies that guide the way the mentor works with the girl. And any girl that has gone through a safe space, you will find her confiding in the mentor, telling the mentor 101 things that she will never have shared with her own mother. So I believe if these girls have skills that ensure that they know that they have self-esteem, they can be able to trust other people as their mentors, and they can be able to bring out what they feel without fear of stigmatization or anything. I believe that this is one of the motivating factors that is allowing girls that have gone through safe spaces to be ahead of others. Thank you.
Thank you very much, ma'am. So, Dr. John, to you now. Obviously, a lot is being done, and I'm not sure whether you had arrived when the minister was speaking quite extensively about some of the work around adolescent health within the ministry, and I know you are heading 𝗣𝗲𝗀𝗃. And so a quick question I have for you is, what programs is the government currently driving through your team, and of course linking to the states, that's addressing harmful norms, especially focused on very young adolescents?
Okay, so thank you very much, the moderator, and thank you, everyone. So for us in the Federal Ministry of Health, especially the Department of Family Medicine, so that department actually is positioned to attend to every member of the family, the adolescent inclusive, male and female. Now, in the Family Health Department, we now have the 𝗣𝗲𝗃𝗃, which is the division that I head, gender, adolescent, school health and elderly. So most of the spectrums within the family are tackled there. Then, when we come to the aspect of the adolescent and school health, we have a full branch that tackles all issues and programmatic interventions that speaks to adolescent and school health age. Because we believe that at the Federal Ministry of Health, that gap, we should pick it up from the school health, preschool, and up to the school health and all that. So the programs that are there in order to make sure the norms are tackled, actually we work with partners. We have the National Adolescent Health Policy. In it, we address policy pronouncement and policy trust that helps to make sure we demystify anything that have to do with norms as it relates to the girl child. Then we equally have the sexual reproductive health rights policy of women and girls. In our own case, we included persons with disability in it because we believe that if the young adolescents are actually having some social norms that affected them, then those of them with disability are further disenfranchised when it comes to the norms that affect them the more. So that is also in place. And currently and presently now, we are already in the process of reviewing that policy. And we are reviewing it with the mindset that the sexual reproductive health policy in the ministry, which is domiciled in the reproductive health division, now that of the SRH should leverage on it, and then we have a policy trust for persons with disability and vulnerable population within that spectrum. And beside that again, in the 𝗣𝗲𝗃𝗃 division, we're not going to have a standalone strategy that speaks to the SRHR, sexual reproductive health rights of adolescents and vulnerable population altogether. So these are in place, and then we have the political will within the ministry in order to make sure this works. And that political will can be attested to the presence of the Minister of State, who is here actually to drive it. Thank you very much, Honorable Minister. Thank you. So the political will is there. So we'll be giving all the backing, and then for us as technocrats to ensure that we work in cohesion with our team. And the teams we work with, actually, with the organogram within the ministry now, we now have the RAMCA swap coordination steering committee. The RAMCA swap steering committee, the minister is sitting at that position, supported by the management team. And then we that are in the former RAMCA core technical group, we are now reporting to that particular steering committee. The whole idea is to make sure there's no duplication and wasting of energy and resources so that we can continue to provide information on how best we can do. And with the policy things that the current government and ministers are doing, you can see that we're already on the right path. I will speak more on it. Thank you.
Thank you very much, sir. We're jumping ahead of time, so I'm just going to look at, take one minute from each of the panelists, because I really want to give the Honorable Minister of State for Health an opportunity to kind of round up this session, and we are chasing time. So I'd just like to say, if you wanted to prioritize one thing, one partnership, whatever group, government, faith-based, youth groups, education, to accelerate transformative change for very young adolescents in gender norms, what would it be? Starting from Dr. Amina.
Thank you very much. So for me, I think youths, two things they need is confidentiality and trust when they are, in the health facilities or any of the service delivery point trying to access health services. So if that is the case, they will only trust themselves for now, because we haven't given them reason to trust us for now. It means that what I would prioritize would be youth-led, anything that is youth-led, any intervention that is peer-related, so that they will talk to themselves and they will be able to have, peers that they can trust, that can speak for them. And it also can be digitized. If we can get like kind of a digitized mechanism where they can provide their feedback or their thoughts anonymously, that way we'll be able to even understand their thoughts, their needs, and the services that they require, so that we can be very prompt and apt with the services we deliver. So youth-led, youth-focused, nothing for them without them, and then digitization. Thank you.
Thank you very much. Okay, so Dr. Emmanuel.
So for me, looking at gender norms issues and recognizing the fact that they are multi-layered, it will be an approach that is all-inclusive, a partnership that involves practically everybody. The providers need to be involved, the community persons need to be involved, mothers need to be involved. Situations where silence will still persist in communities need to be strictly avoided by an all-inclusive partnership mechanism.
Maybe I'd like to add, just to say maybe in 30 seconds, because I know I'm asking you another question again. How can service providers be accountable to young people?
So the service providers, we should be able to get them to pull away from being the ones who are actually pulling out our adolescents from taking up services. I know you said you said 30 seconds, but if I can just extend that a bit. In my earlier days when I started working with MSI, we had identified providers that would train in a place like Abba and mobilized clients to go there. And a provider just saw a young lady and asked her, "What are you doing here?" And she said, "I came for family planning services," and she told her that, "I'm going to tell your mom." And that was it. She left there. Her friend that she would have mobilized equally to come and take up those services never came again. And we need to find a way to make sure we are engaging these providers to ensure that we break the silence.
Let me go to Dr. Habiba. Dr. Habiba, for you, what partnerships would you like to see to address gender norms?
I am happy that at this gathering today we have the Honorable Minister and First Ladies and other partners. I believe that if the government of Nigeria can take the life skills safe space component into every school, from primary to secondary school, for every girl and even boys to go through and get these life skills, I believe that we will not be here discussing this issue of gender norms or early marriage or whatever. Every girl will be able to get the skills that she needs to live a better life. And I always tell most of the men that any man that marries a girl that has gone through safe spaces and have acquired all the life skills will have no reason to divorce her. And I believe that. Thank you.
Thank you very much, ma'am. So, of course, you're talking about partnerships between education, livelihoods, social development. I'm just reiterating what you said. Okay. Dr. John, partnerships. Which particular partnership would you love to see?
Currently now, we are actually implementing the EU SERA project and the EU's SERA project is an innovative initiative that is actually making impact. We have 3 states, Sokoto, Adamawa, and Kwara. We call them the FLAC states. And the partnership is so rich that adolescents within these states, actually, the services that are being provided to them is strengthened. The facility where the adolescents go to access these services is also refurbished. And it's an integrated service provision that we are thinking of. Standalone adolescent health center may be too expensive looking at the economy. But when you have an existing PHC and you create a functional adolescent corner within that existing PHC, it's easier and cheaper. And when you build the capacity of the frontline health workers that are already there, using the government-approved training manuals that we already have in the Federal Ministry of Health, which we have done in these 3 states, is superb. And when we now encourage them to step it down, then the message, then also creating the awareness among the adolescents to access services. I think including them and planning with them and implementing with them. Thank you very much.
So like the adolescents will say, nothing for us without us. So again, the important role of engaging adolescents, there are lots of tools that many people have used to ensure that the adolescents' views are actually taken on board as we continue to design and address gender norms. I'd like to say a very warm thank you to the panel that's here. I'd just like to maybe reiterate 1 or 2 minor things that they said. Obviously, the recognition of adolescent health and, looking at both adolescents who are very young as well as the older ones, articulating partnerships, multi-sectoral partnerships, addressing stigma that drives very young adolescents away from primary health services, and then strengthened commitment to partnerships across ministries, the private sector, civil society, and development partners for sustained impact and transformational change. At this stage, I'd like to warmly, once again, invite the chair of this session, who is the Honorable Minister of State for Health, to come with his closing remarks. Thank you very much, sir.
Thank you very much, Dr. 𝗣𝗲𝗶𝘀𝗀𝗀, for a very wonderful moderation. And let me also appreciate the panelists for their very, very useful submissions. Clearly, our adolescents are the future of our society. They are the future Tinubus, the future Abiodun, the future Uzodimma, the future Salako, and so on and so forth. And so if we care about our country, we must prioritize their issues. Some of the key things that have been mentioned, I'll just highlight a few of them. Dr. Amina specifically speaking around how do we make our health institutions more adolescent-friendly, creating what specifically for them, ensuring that our health workers are better trained to be able to handle adolescent issues, and also even creating special clinics or specific clinics to be able to address issues of adolescents. I think these are very important suggestions that we must look at how to take them on board. Of course, they also talked about the bias of health workers, and I think that is very important. I had a very practical example when I was much younger in my secondary school, and I remember a lady then who missed her period, and all of us just concluded that she was pregnant. Even the health workers, 𝗣𝗲𝗀𝗀𝗀𝗀, what did you do? Confess. I didn't know until I entered medical school that the stress of exams alone can make a woman miss her period. Those are biases. And even us as parents, we also go through these biases that we don't know. And importantly, most parents, and I think for most parents you will see, at that transition period from adolescent going to adulthood, most of us find it difficult to handle. And it is therefore important as part of our strategies to also look at how religious organizations, how communities can also counsel parents on how to deal. Because when you talk about mentors, for example, the best mentor are still the parents. But if the parent doesn't understand, how can he mentor? So we must also look at that. The issue of stigma is also important. We should not just because of the age of somebody conclude that it is this way. Then I also appreciate the issue of life skills into our educational system. I think it's very important, and also encouraging schools to have a school health program that's able to support the issues of adolescents at school. So I think by and large, this is an eye-opener to quite a number of us. And as representative of government here, I assure you that a lot of those suggestions that have been mentioned have been captured. How do we ensure that there's confidentiality and trust? And how do we digitalize? Because when you digitize, you make it more attractive to adolescents. So how do we do that? How do we build an all-inclusive partnership? How do we introduce life skills into our educational system? And how do we be more efficient by integrating services? Thank you, and God bless.